Good afternoon to all. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and I welcome you all to this show. Did you know, according to an article published in PubMed, prostate is the second leading site of cancer amongst males in Delhi, Kolkata, Pune, and Thiruvananthapuram. It is the third leading site of cancer in Bangalore and Mumbai, and it is amongst the top 10 leading sites of cancer in the rest of the population based cancer registries of India. Old age, obesity, improper diet, and genetic alterations have been identified as some of the main contributing factors towards an increased cause of prostate cancer. But it is alarming to observe that most people are not aware of the cancer risk factors. There are many options available for cancer treatment in India, which might be used at different times depending on the prostate cancer stage and current health status of the patient. But most patients in urban and rural cities lack the information and access to such treatments. Hence, to spread the awareness on this very important topic of risk of prostate cancer, Integrated Health and Wellbeing Council has partnered with AstraZeneca on this exclusive Prostate Cancer Awareness Series. The topic for today's talk show is Know Your Risk. Have you checked for prostate cancer? And to shed light on this, we have a very eminent panelist here with us today. I welcome Dr. Surendra Kumar Beniwal. Dr. Beniwal is the consultant medical oncologist and hematologist for Department of Medical Oncology at Acharya Tulsi Regional Cancer Treatment and Research Center and SP Medical College in Bikaner.
Thank you. Thank you very much for your kind introduction.
Yes. I believe the introduction was there, or was there some network error, I believe? Okay, so let us start with the discussion moving forward. So Dr. Surendra Kumar Beniwal is the consultant medical oncologist and hematologist for Department of Medical Oncology at Acharya Tulsi Regional Cancer Treatment and Research Center and SP Medical College in Bikaner. Sir, we welcome you to the show. Let us get started with the discussion.
Thank you.
So, as the topic for the discussion is prostate cancer awareness, can you please help us identify and explain to the audience what prostate cancer is and how it develops?
As you have already told that the prostate cancer is one of the commonest cancer in male, because prostate is an organ just found in only males. So this is the cancers of male and not bothering about any female. And this is the second most common cancer, as you already told in the world. And in world, approximately 16 lakh population was suffered from the prostate cancer, and out of which approximately 3 to 4 lakh persons are died due to prostate cancer. And the prostate cancer is so much common. That's why we should know about the prostate cancer, what is the risk factor of prostate cancer, and how we can diagnose the prostate cancer early, and we can prevent morbidity and mortality due to that cancer. Prostate is an organ which was found in genitourinary part of a male person, and it helps in various kind of functions during maturation as well as during sexual activity. But when it suffers from cancer, then there are so many problems. And most of problem is that the most of prostate cancers patients are asymptomatic. That's why the diagnosis of prostate cancer was very late, because in early stage there was no symptom. And sometimes we have some symptoms, but that symptoms are more common in benign diseases. It means other than cancer, such as there are increased frequency of urine, there is burning sensation in urine, there is hesitancy in urine. So these symptoms may be found in prostate cancers, but they are more common in urinary tract infection. They are more common in benign prostatic hyperplasia. That's why we miss the prostate cancer, and we will diagnose this cancer in very late stage. So we should know all about the prostate cancer. So we will diagnose this cancer in early stage, and we can treat this cancer.
Thank you so much, sir, for bringing out that point that prostate cancer most often is detected at the very later stages and gets missed out. So, are there any, apart from the ones that you have shared, are there any reasons that are associated with the patient itself not being able to consider this as a serious problem, or not seeing the specialist or coming to the doctor, but not specifically referring to an oncologist to take precautions? So are these reasons some of the reasons also because of why prostate cancer gets missed out for early detection?
As I have already told that the most of prostate cancer doesn't have any symptom. Usually patients are asymptomatic. They don't have any problem. That's why they did not go to any doctor. And second thing, that if they have some symptoms, then these symptoms are usually mimic to the symptoms of other common diseases like urinary tract infections. That's why usually patient does not go to the doctor. And if they go to the general practitioners, then they did not think about the prostate cancer, because they think about normal things. And when we will think about prostate cancer, then we will very late.
Yes, sir. Thank you so much. Let us move on to generating awareness around the risk factors. So can you please help us explain what risk factors are associated with prostate cancer? And are there any specific factors that individuals should be aware of so that in future they are susceptible to getting this?
Risk factor of prostate cancer, we can divide risk factors in two parts. First, which we can modify these risk factors, and second, non-modifiable risk factors. So in non-modifiable risk factors, the most common risk factor is the age. As the age increases, there is more chances of prostate cancer. In less than 40 years, there are very rare chance of prostate cancer. But when the age increases, even in the age of the 80 to 90 year of age, there are more than 30 to 40% patients are suffered from prostate cancer. Either they are symptomatic or asymptomatic. So age itself is a risk factor, but this is not a modifiable risk factor because we cannot change the age. Second non-modifiable risk factor is the family history, because some patients have genetic defect, like some genetic factors which can cause prostate cancer. These are also not modifiable. But if we know that we have some genetic defect, then we can screen and we can detect prostate cancer in early phase. So there are many family factors, like there are some BRCA1 and BRCA2. These two genes are found in ourselves, and if there is defect, then there are more chances of breast cancer, ovarian cancer, prostate cancers. So if any patient has first degree relative of breast cancer in early age, or they have first degree relative of prostate cancer or colon cancer or pancreas cancer, then he can think that there are probably some genetic factor which can cause cancer to me. So he can go to doctor for the screening for cancers. And if there is any family history of breast cancer or two type of cancer in second degree or third degree relative, then he can also think about the genetic defect, and he can go to a genetic counselor, or he can go to the oncologist to detect any genetic defect. And if we have found genetic defect, then he can go for more aggressive screening to detect early stage of cancer. These two are the non-modifiable risk factors. Then there are some modifiable risk factors which can we modify, which we can. First is the obesity. Obesity is the highest risk factor for prostate cancer. So every person should take exercise, should do yoga, and reduce his body weight. So if he is fit, then there are less chances of prostate cancer. Second one is the alcohol. Although there are various reports which are contradictory, some says that alcohol is the cause of prostate cancer, but some reports says that there are less communication, less connection between the alcohol and prostate cancer. But we can avoid alcohol and other addictions, so we can prevent such type of cancers. And another one is the coffee. Although there are various studies shows that the coffee is a preventive factor of the prostate cancer, so we can take a coffee, but in the limited amount. And various other studies also done for the vitamins and various nutrients, but they help them to prevent the prostate cancer, but they are not clear-cutly proved for decreasing the risk factor of prostate cancer.
Thank you so much, sir. So generally, it is seen that prostate cancer is detected more in older males. So can you please explain if age is one of the risk factors? Do you generally get more susceptible to prostate cancer when you age old? Or are there cases that in younger population also it is there, but they get cured, so that is why it is not, commonly heard? What
No.
is the right?
As I already told, that age is the most common risk factor. As age increases, there are more incidence of prostate cancer. That's why most of elderly patients are detected by prostate cancer. If younger patients has prostate cancer, then they have more aggressive disease. So as the age increases, there are higher chances of prostate cancer. And sometimes there are some studies where they go to autopsy or the postmortem of age of 80 to 90 years, and what they found that there are approximately 40 to 50% patients had cancer in the prostate, although they are not died due to the prostate cancer. So the prostate cancer is a disease in which oncologists have to decide either we have to treat or not treat. Sometimes 90-year-old patient diagnosed prostate cancer, but the cancer is very less aggressive, and life expectancy of 90-year-old is more than 5 years, not more than 5 years. So we have to decide we have to treat or not treat in these elderly patients. And the elderly patients diagnosed with prostate cancer is due to the age, not by chance.
Thank you so much, sir. Let us move on further on discussing more on to the prostate cancer. So we would want to know what are the recommended screening methods that are there if someone is susceptible of having prostate cancer, and what are some specific methods that help in early detection?
For prostate cancer, there are many proved screening tests which we have to start after 50 years of age. And if there is any genetic risk factor, then we have to start even in earlier than the 50 year. And one of the most common is the PSA. PSA is the prostate specific antigen. It is a type of blood test in which we detect PSA, and if the PSA level is more than their according to their age, then there are more chances of prostate cancer. PSA is not indicative of the cancer, but we can alert that the PSA is higher, than there are more chances of cancer. If age is less than 50 years and the PSA is more than 2.5 in his value, then we can think about the prostate cancer. But we have to rule out other causes also. Sometimes there are trauma, sometimes there are urinary tract infection, or even 48 hours within the 48 hours of sexual intercourse, there may also reach the PSA level. So if any patient comes to us, we can screen by the PSA, and if the PSA is raised, then we have to do a PSA after a few months again, and then there is still raised the PSA, then we have to do the biopsy from the prostate cancer. So the most common and most important screening test is the PSA test. And another thing is that if the PSA is slightly raised, then we have to do this frequently. And if there is a raise in the PSA range 0.75 nanogram per year, then we have to think of the prostate cancer, and then we have to do biopsy. Another screening test is the digital rectal examination, in which the surgeon or the oncologist do the examination of prostate through the rectum by the finger, and in which he feel the prostate cancer from the rectum, and if there is any nodule and any hardening, which we will found by our experience, then there are more chance of prostate cancer, and we have to do the biopsy. These two are the most common screening tests, but these screening tests are not fully 100% sure for the prostate cancer. But by the help of this digital rectal examination and PSA test and the rising of the PSA, we can detect prostate cancer in even very early stage.
Thank you so much, sir, for explaining that. Also, can you please highlight if somebody has family history of prostate cancer or gynecological cancers amongst their family women? So, what are the screening protocols for them, and do they vary from normal people who might be susceptible to prostate cancer but not have it in their family history?
If any person have family history of prostate cancer in early age, if his first degree relative has prostate cancer in early age, or he has a first degree relative of any gynecological malignancy or breast cancer, then there are more chances of prostate cancer. Then first of all, they have to do the genetic test of that their relative, and then if they found any genetic defect, then they have to do these tests in that index person. And if they found the genetic test positive, then there are more chances of prostate cancer. Then we have to do these screening tests in early age, even at the age of 40 years, and then we have to do our more frequently.
Thank you so much, sir. So let us now discuss on to the prevention of these risk factors. So are there any preventive measures or lifestyle changes that individuals should adopt to reduce their risk of developing prostate cancer? Again, we will take this question for two cases. One in which there is no family history of prostate cancer, and the other one in which prostate cancer family history already exists.
If a person have no family history of prostate cancer, then she can reduce the risk factors by doing regular exercise to decrease the obesity, and not taking alcohol and smoking. These by these he can decrease his risk from the prostate cancer. And if patient suffered from any genetic defect, then he have to do take these measures as well as screening test.
Thank you so much, sir. So we would also like to know how effective are the current treatment options that are there available for prostate cancer. Also, if you could briefly explain the different treatment modalities that are available in India.
In a modern science era, we have very good available treatment for the prostate cancer. And we can divide this in two things. First is the metastatic prostate cancer, and second thing is the more non-metastatic. It means if cancer is localized to the prostate, then our aim of treatment is to cure the patient, to cure from the cancer. And if patient has metastasis, it means his cancer goes out from the prostate and any other organs like bones. Then our treatment is to decrease his symptom as well as to prolong his life. So if patient has only prostate cancer in the prostate, then the first treatment of choice is surgery, in which we do a radical prostatectomy. It means we remove the total prostate as well as lymph nodes. In last 10 years, there are very dramatic improvement in such type of surgeries. 10 years before, in radical prostatectomy, there are so many complications, so many long-time side effects. But nowadays, robotic surgeries are available. By the help of these, we can do very fine surgery with less side effect and less long-term complications, and we can cure the patient from the prostate cancer. And if patient is not fit for the surgery, like patient is frail and patient suffered from various other comorbid illness like diabetes, then the second modality is radiotherapy. If patient has a localized disease to prostate cancer, so we can cure prostate cancer from the radiotherapy with the very good techniques like IMRT and IGRT, in which they give a radiation to the prostate site of the prostate cancer, and they can cure the prostate cancer. These two modalities are helped into curing the patients. And if patient is already diagnosed in stage 4, like the prostate cancer has most common site of metastasis, bone metastasis. That's why usually patient presents with the bone pain like backache and various other problems. So with the help of various tablets as well as the chemotherapy, we can improve the symptoms of that patient, and we can improve the life of these patients. Nowadays, various pills are available. By the help of these pills, we can avoid the chemotherapy and we can increase the life of these patients. And previously, for any genetic defects, tablets are not available, things are not available. Nowadays, if there are genetic defects, then various type of drugs like olaparib, which was effective in the genetic level, and we can increase the life of these patients.
Thank you so much, sir, for highlighting that. Also wanted to know if there are any recent advances or new developments in the field of prostate cancer treatments that our audience would be interested to know more of, or any advancements that you feel that are ongoing and in future would be of great help in this prostate cancer treatment.
Previously, prostate cancer treatment was not personalized. Previously, we will give the treatment according to the stage of the prostate cancer. If patient has lesser stage, then the treatment is fixed that we have to do the surgery or radiation, and if advanced, then we have to do the chemotherapy. But nowadays, the treatment was more personalized. Nowadays, we will do the molecular study of that cancer. We will do the various genetic tests, and we will try to individualize the patient treatment for that particular type of patients. And with the help of these individualized or personalized treatment, we give more accurate treatment to these patients, as well as with the less side effect. As I already told that if patient has BRCA1 or BRCA2 positive, then we can give a particular drug, olaparib, which was helpful for these patients with the very less side effect. But if patient does not have BRCA2 mutations or HRD mutations, then this drug is not helpful for such type of patients. So nowadays we have to move from conventional treatment to individualized or personalized treatment. And with the help of this personalization, we will improve the quality of life, less side effect, as well as we will improve the curative of this disease.
Thank you so much, sir. So there is an ongoing myth around this that is common in people, that any kind of surgical treatment for prostate cancer would hamper their erection. So can you please help us clear out their myth? Also, if there are specific treatment options, surgical options such as nerve sparing surgery, etc., that you would want to highlight that is specifically helping in not affecting erection and prostate cancer treatment together.
In era of 10 to 15 years back, when the radical prostatectomy did by the general oncologist, oncosurgeons, then there are various damage to adjacent organs, and due to this, there are various problems to that person, like incontinence of urine for very long time, and there are retrograde ejaculation. It means he will not able to enjoy his sexual life after the surgery, and there are various type of erection defect in after the surgery. But nowadays, with the help of robotic surgeries, we can preserve these organs, we can preserve these nerves, and due to this, there are only incontinence of urine for only 1 or 2 months, and he can after the treatment, he can enjoy his life with good quality of life for sexual as well as various other aspects.
Thank you so much, sir. Also wanted you to highlight the importance of regular monitoring and follow-ups post prostate cancer treatment. What does it involve and how important it is? If you could put that out for the audience.
Regular monitoring is as important as the treatment of prostate cancer, because if we did the surgery for curing that patient, then I have already told that we have to do PSA, prostate antigen, like a blood test for detecting the prostate cancer. In this, when we did the surgery, then patient is cured, then we have to do regular follow-up with the PSA as well as various radiological tests. And in these, PSA is usually 0. And if we did regular follow-up, and when the PSA, if disease reappear and PSA appears, then we have to treat this patient again in the curative intent. We can give radiation to that site. If we did not did the regular follow-up, then there may be chances of metastasis, and we can lose the patient. So regular follow-up is very important. And for the metastatic setting, we have to do regular follow-up with the radiological test and various other type of blood tests. And with the help of this, we can monitor the response of our treatment. We can monitor the progression of disease, and we can monitor various side effects. So, if with the regular follow-up, we can de-escalate the treatment, or if needed, we can escalate the treatment, and we can detect the disease progression earlier, and we can save the patient.
Thank you so much, sir. So as we are down to the very last question of the session today, what would be your key takeaways for the audience who all are watching this show?
Because now today we will talk of the prostate cancer. Every male person can have prostate cancer, because in lifetime there is a risk of 1:8. It means in his lifetime there are 8 out of 8 1% suffered from the prostate cancer. So he should be alert, especially after the age of 50, and he should do his regular exercise. He should keep his daily lifestyle very regular, so he can prevent the cancer. And if he detect the cancers, he should not fear about the cancer, because prostate cancer nowadays curable in the early stage. And if even if detected in the late stage, then there are he can enjoy his life for years together with the help of treatment. So he should not fear about the cancer. So I will give the message to general population is that you should do your regular physical activity, and you should alert about any abnormal symptom. And if he has any abnormal symptom, then he should go to urologist or an oncologist or general physician to detect early disease.
Thank you so much, sir. With that, we wrap up this very interesting session on prostate cancer awareness today. Thank you, Dr. Surendra Kumar Beniwal, for taking out time from your busy schedule and imparting us with wealth of knowledge around this topic. Thank you so much. We would also like to thank our partner, AstraZeneca, for partnering up with us on this very important prostate cancer awareness activity. Thank you so much. Lastly, we would also like to thank our audience for staying with us till the very end. Thank you. With that, we sign off now. Stay happy, stay healthy. Thank you so much.